Hello and welcome to Estates for GP Surgeries. For those of you that haven't been on any of my previous webinars, my name is Luann Stewart and I, like many of you, am a practice manager full-time in a rural practice at the moment, but I've worked in various practices and it's my experience in those various practices organising the estates for them that have made GP Excellence ask me to work with you on how to improve your estates in your own GP surgery. I also consult on various estates projects for various GP practices in my spare time. So I have varying amount of experience in anything from altering a room from an admin room into a clinical room, or in fact, doing full extensions. And I'm currently consulting on a £12 million new build. So hopefully some of the bits that you can learn today might be useful for you going forward. So let's start by thinking why. We're all very busy and we're moving into a more digital age. So why are we looking at improving our space or adding to our spaces? Well, GP surgeries are really becoming overcrowded and quite unworkable. We need to find some solutions. We need to improve our current space and we need to really make some more space. We don't know what's happening with the PCN and the ARRS roles at the moment. We are waiting for updates from the current government. But again, if that increases as expected and we have more and more shared staff, they take up space and we need more space for them to be able to function and grow and become part of our teams. There's a lot of hurdles that we'll be facing to try and improve things. So I'm going to try and ease you through this and make things as easy as I can so that you'll have a little understanding. There's also a bundle of documents that will be available, and that should be explained to you within the linkage when you get this to how you can obtain those documents that may help you work through the difficulties of organising your estates within your practice while you're also working hard as a practice manager. So before we go headlong rushing into building extensions and getting new buildings, we need to actually look at the space we have. Is there anything you can improve on what's already in place that would be a much cheaper option for you? Try and look at it with fresh eyes. Maybe get someone to come with you. I certainly use my assistant manager to wander around with me because she may have things in a slightly different view. Perhaps your clinicians, if you've got someone with a keen eye. And then think about where we start. Don't get more space or an extension or a new build unless you've utilised all of the space you have or all of the usable space. We all have unusable things. But can they be used in a different manner to free up some space somewhere else? So we need to really look at things with a fresh eye. While you're doing this, and if you are going to be getting some funding towards this, look at everything all at once. Don't just consider the more space, but think, is the current space actually legal at the moment? Is the flooring infection control approved? Do you still have skirting boards? Up till a few years ago, it was considered okay to have skirting boards in admin rooms or in corridors, but now we are supposed to be like a hospital where you have those lovely curved floors that go up the side of your walls to make sure there is no infection that can be caught between floor space and wall space. So everything is those lovely curves that go in there and no more skirting boards. Do you have proper clinical sinks with elbow taps? This is a picture of a correct clinical sink, so there shouldn't be one of those kitchen style cupboards underneath it. They are really a no-no these days. Are the size of your rooms acceptable? There are rules where we can have slightly smaller rooms these days, and those smaller rooms can be allowed because the building's already in place and there really isn't a provision at the moment to update every single room. But if you're having some work done and you are claiming for some money from NHS England, consider everything at once because it's much easier to complete one piece of paperwork for all of this. So we'll think about an easy one. At the moment, some of your admin staff may be able to work from home, or you may be able to be working in different shifts, or you may have gone to a outsourcing a lot of your admin, as many places are. And therefore, your shortage is your clinical rooms where your patients can see people face to face. So we are going to look at changing an admin room into a clinical room because that's really quite an easy one to do and is relatively cheap. It may also be one that your partners feel comfortable doing even without funding because they may be able to self-fund this as there are a lot less costs involved. This is actually one of mine. It is a not really an admin room. As you can see, it became more of a dumping ground in the upstairs of a branch surgery where I'm working. And there were a lot of bits of old furniture that had been placed in there over the years. And you can see in the background boxes and boxes that have come back after digitalisation of the empty Lloyd George records. These are things that now we've been given permission to actually get rid of. As long as you do that safely, you can get in a shredding company to take them away. They are taking up an awful lot of space in the corner of a room. So the first thing obviously was to clear all that clutter, get rid of old bits of furniture, things that are no longer safe. You can see a cloth chair in there, that the fan that wasn't working anymore, but someone thought, let's just keep it just in case, and get rid of a lot of that clutter, emptying the space. After we'd done some work on updating the floors in this room and buying a little bit of new furniture, we turned from this unusable space, oversized area as I said, a dumping ground, to this, a lovely clinical space here with a desk under the window, nice official clinical sink in there, and of course your couch for your patients. But this turned it into a beautiful room and adding to our clinical space. We also looked at the same time at a dispensary. As you can see, our dispensary at the time seemed to be some old kitchen cupboards that had been repurposed. Lots and lots of clutter, very difficult to find things. Now, this is the time really when you get your dispensing staff, if you have a dispensary, and ask them how they work. Don't assume as a manager that you should be taking all of this on. You need to find out how people work in their own rooms. And as long as it's infection control proof and legal in every way to work like that, then make it work for them. Get that buy-in from your team. And this is how we ended up. It was actually a very cheap fit. These are open kitchen, old sort of kitchen cupboard frame type work, but it worked for our dispensers and they got exactly what they wanted at that point, and a nice clean looking space with proper infection control flooring in there. So we're going to take you through the steps after that little case study to show you exactly what your stages are. And it's not to be rushed. Everything you need to take your time on this because you are still doing the day job while you're working with this. So step one, clear the clutter. I'd like to assure you this isn't somewhere I've worked. We're not quite that messy, but I thought it was an ideal picture to show how people over the years collect more and more things, keeping them, often with no reason. I've just cleared out one of my GP's rooms that is filled with old MIMS books that are way out of date because every time they got a new one, the old one went on a shelf. Little bits of clutter like that can be cleared away. You can start archiving or digitalizing your paperwork. Spending a little bit of time digitalizing everything means you can get rid of cupboard after cupboard, opening up space where you could perhaps pop in an extra desk. It does take some time. You need to scan things slowly into digital files, but again, it really clears some space. Or you can archive into the loft. I would first clear your loft because you will probably find things back from the 70s and 80s that people had popped into there thinking, we'll sort that one time. And they won't. So it's quite a good idea to run through and clear all your loft space out and then archive into it with clear archive dates. There is an NHS England booklet that gets updated each year, which tells you how long you have to keep things. And that's something that you can archive into the loft with a clear date, and once a year go in and get rid of those things. And then maybe digitalize going forward so that eventually you won't have all those things. Empty the rooms, scan and shred. Those of you that sit with a shredder, shredding each item, that may work in a small surgery at general times, but I would strongly suggest you get in one of these shred companies if you're doing archiving, because you will have bag loads and bag loads. Employees' time shredding is actually more expensive than having it picked up. So in the end, it's actually cheaper for you. But still continuing in step one. So step one, part two, don't do it all yourself. Delegate, get help. Clinical staff should be clearing the clinical rooms. If you're lucky enough to have protected learning time, sometimes an hour of that could be spent getting things clear that clutter. Involve the whole team. If you get a buy-in from the team, then you're much more likely to have them not complaining when there's the noise and aggravation of things happening to improve their space in the long run. But in the short term, it is obviously creating noise with workmen in. Maybe they'll have to use a different room. So get that buy-in from the beginning if you can. It makes your life much easier. And then when you have a workable space, to start to plan your rooms and try and think a little bit outside the box. Consider different desks in different rooms. Consider moving your desks, perhaps instead of all against a wall, back to back with just the shorter part of the desk against a wall and coming out into the centre of the room. Sometimes moving your rooms around can give you more space than you ever realised, and you can fit maybe an extra desk in an admin room that you really didn't believe you had space for. I like graph paper for this. You can buy a cheap graph book, somewhere like Amazon, and draw out your rooms, work out the scale, go around, measure all your furniture, and then draw it on there in various different ways. And you can often find that there are much better ways of having your room so that you have that bit more space to work with. So plot things onto a graph and then work out the cost. Now, this could be, if this is a small space, this can be for you to work out the cost. You can work out roughly decoration, any new furniture, moving things around. We're not talking about a major redevelopment, but maybe just a small cost of buying an extra desk, turning a few things around, maybe getting a skip in. And discuss that with the partners before you start spending, in any usual manner that you would discuss things within your surgeries. We all have different things that we have to discuss at partnership level. Then we move on to step 4. Keep your team involved. So tell the team, plan your timing. I know it sounds silly, but do we want to have 2 rooms out of action while they're being decorated in the middle of flu clinic time, or sometimes it's easier actually in the summer holidays when half of your team have probably booked holidays, those with children, so they're out, and then you've got a bit of more space to move people around. But do consider that. Can someone work from home for a few days? Do you need a grant? If it's getting to a reasonable amount of money and you obviously are going to need a grant, or you just want to try for a grant, this does take some time. If you don't need a grant and it's a very simple thing such as manoeuvring desks around, maybe a spot of paint on the walls, then plan a date, avoiding that service disruption, and make it happen. Sometimes these things can be done quite quickly. Some things need a lot more time and a lot more thought, particularly the more costly extensions or additional space being added on, or major refurbishments. So we'll now look at creating space in your administrative area. And wouldn't that be a lovely office to work in? Certainly I would like that one. So steps 1 to 4, just as before, we clear the clutter. It's amazing how many bits of unwanted furniture that have appeared. Someone's had a bookcase at home that they really haven't wanted, and instead of getting rid of it, they've popped it into work just in case. Old sofas I've found, definitely not infection control, that have been popped in by a partner as a nice little addition for the staff room, only it's actually filling up our staff areas. So get rid of that unwanted furniture. Gumtree, Facebook, it's actually better to even put it on as a free pickup as long as someone takes it away rather than paying for a skip. So have a little think about that and think, is there any way you can get rid of some stuff and not have to pay for it? Move things around, create some space. Then hopefully that may be enough, and you may not actually need to do much more than moving things and thinking outside the box and getting rid of the rubbish. But if we do need to, we may have to start thinking about an extension. Now, amazingly enough, I've actually dealt with a few places where they've got as far as calling in an architect, and the moment you've got an architect involved, obviously there's costs involved. And they haven't even owned the building. They haven't been aware of that as a new manager. They haven't looked into the provenance of, is this an NHS properties building, in which case only NHS properties can make sure that you can have an extension, and that would be down to them, not down to you. You can ask the question and work with them, but they will have the final say. Could be a private landlord. That would depend entirely on your lease. Some leases allow you to make additions, but they will ask you to pay for those additions, and then you can end up paying more rent. Some will work with you on those additions. Some will absolutely say no. But if your partners own the building and therefore you do have, or your partners have full say on what happens with extensions, you now need to look in a different manner. Do you actually have the land you can add to it? You can't have an extension without the land. And NHS England and the monies that are available are not available for buying land or buying property. They are only available for adding on to your own areas, unless you have a very special deal with them, and that would be a particular side deal that you need to organise and make within your estates team, and they will work on your behalf. Your estates team at the ICB will work on your behalf if that is a new build or something of those levels. But generally with an extension, you are looking at land that you already own. Can you add to it? Can you add an extra building onto that land, or an extension attached to your current building? Or if you don't have the space, can you move upwards into the loft area? Is there any possibility of opening up rooms upstairs? And think again outside of the box. You may need more clinical space, and you think, well, the loft space won't possibly work. But you could move your admin into new rooms in the loft space and then change those admin rooms into clinical rooms. So you have to think 1 or 2 or even 3 steps ahead at all times. 1 story or 2. Now, often people say, well, we only need 1 story for clinical space. That will be cheaper. And it is cheaper at first. But in the long run, a 2-story extension actually works out pound for pound, or space meterage for meterage, much better value. That's because you're still paying for a roof to go on top of that 1-story extension. So you're still paying for a lot of the stuff. It's a few more bricks. Sometimes if you can't quite afford the full refurb upstairs, you can afford to have a space made and then shut off so that the walls aren't completed to a satisfactory standard. It's not decorated. The electrical wires might be coming through, but not your plug points and everything. And you can use that as an extra storage area, with the view that that can be opened up in a few years when you have some more money. But if you do that, be aware that obviously there may not be funding in a few years to do the actual upgrades. So it depends on the funding package you have and your needs and wants at the time. But definitely 2 stories works out metre by metre much cheaper than 1. But you need to think, and this is definitely a discussion for your partners, can you actually afford to start moving towards that extension? Because there are no guarantees. So to start doing this, first of all, and I would do this anyway because this part is free, clear the clutter, get rid of everything, plan your thoughts, talk to your partners, and have a look and a read through the new premises directives that have been released. There is more money now available. The new premises direction do say that we can go up to 100% in funding, but you need to ask the ICB what their thoughts are on this. Some ICBs are still staying with the old 66%. Some will vary it project by project. And you need to get a little bit of understanding. Each ICB will have an estates lead for your area, and that is the person that you would initially talk to get some ideas. Don't rush ahead assuming there'll be 100% funding, because as I say, that's not always available. So can your partners actually afford the first stages? Because the first stages that you have to get completed just to put in your PID or your project form that you go for to claim your money, you have to get various stages done, and before you get to that point, before you can put in that project initiation document, there has to be surveys done, architect forms, planning permission even, and all of that is expensive. You will, if your project is agreed, you will be able to then claim back the percentage that has been agreed, whether that's 66% or 100%, you will be able to claim that back. But if your project is turned down, you may have spent a lot of money and not get any of that back. So there's a small gamble there, and that gamble is really for your partners to decide on, because we are probably talking in the tens or 20s of thousands before it's agreed. So that is something to really think about with them. And I will suggest that you, whatever you do, please use an NHS approved architect. They must be approved for the process to run smoothly, to understand the restrictions and the regulations around things like room sizes, types of materials that are allowed to be used, working strongly with your estates lead at the ICB, because there will be some working back and forth between them to make sure things are legal. If you have a regular architect, they often don't understand this. They will often add on flourishes and things that are useful for their own architect business, because it looks beautiful but perhaps isn't workable in a GP surgery. There are a few NHS approved architects, but they are definitely your better ones to work with. Please do not allow, if you have an overexcitable GP partner who perhaps believes that they could have been an architect and they want to make some drawings, they can do that initially to show the architect what they want, but their drawings will not be accepted, and this is not a way of saving money. This is a way of not getting your project approved. It is quite challenging for people doing this for the first time to find NHS approved architects that they feel comfortable with, or builders that they feel comfortable with. Again, you need an NHS approved builder, otherwise often things will be turned away. I have added a list of NHS approved builders and architects that I've used in the past within the bundle of documents that you'll be able to get. And that's just not for you to necessarily use them, but it's to give you a starting point to know who to talk to and to get some ideas from. Normally, an architect won't charge you just for that initial consultation, a quick chat about what you would want. The charging will only come in at the point where they're actually doing some work for you and doing some drawings. So that initial chat, you want to have a proper plan in place. You don't want the architect deciding everything for you at that point, because then you are paying for a lot of his thoughts. You want to get some ideas and then let him draw it out properly. The other thing to look at for funding wise is Section 106 monies and community infrastructure levy funding. So there are different amounts of money. Now, this is your council money. So to simplify this, if you haven't come across Section 106 or Community Infrastructure Levy, which is often known as SIL money, what happens with this is every time a new housing estate is planned and planning permission is sought, it is possible, if your estate's lead at the ICB is forward thinking, that they will have a plan in with the council that each time this happens in an area, immediately it triggers a Section 106, which is a command that all those extra houses coming in will actually add to the population for GP surgeries or hospitals or roads or schools, and there will be a plan that those builders must pay some money back into the community towards any improvements that are made within those areas, GP surgeries, schooling, etc. You cannot make that initial plan with house builders. That plan will be done at ICB level, but that plan needs to be in place as planning, the initial planning document goes in. So it needs to be an ongoing thing, and it is worth asking your ICB, are they actually initiating these documents? Are they ready with this? It's quite a complicated area to understand. So in your bundle, I have placed a Section 106 monies and community infrastructure levy funding policy that was set up in Lancashire. That's because I work in Lancashire, so I have the ability to get that paperwork, and this is something that's freely available for us in Lancashire. It is something that your ICB should hopefully have a similar document, and that's something for you to ask them to see if they can provide you with anything that will explain if there is funding available in your area. This funding is not to be sneezed at. If you have a lot of building going on around you, and this might be that I know some of Manchester is going to be very full, but there could be a commercial area that's perhaps been levelled and great big blocks of flats have been put in, such as some of the flats around the Deansgate area that have gone in that host lots and lots of people. In those cases, if the Section 106 have been put in, they will look at the average amount of people in a property. So it's not just the amount of properties, but it's whether they're 4-bedroom, 5-bedroom houses or 1-bedroom flats. And there should hopefully have been that money put aside, and that money will sit there until it is claimed if it has been initiated by your ICB. If that money has been put into place and initiated by your ICB and is just sitting there, if you are planning an extension, it is up to you to go to your estates lead at the ICB and ask, is there any SIL or Section 106 money? And if there is, can we draw this down and then find out how much there is? I recently did that with an extension on a branch surgery. I think you're going to see the pictures of that later in this slides, and managed to get around the 30,000 mark towards that project. Now, okay, the project was quite a lot more than that, but that was 30,000 towards it, plus the 66% as it was at the time from the NHS. So I could add that 30% into the 60 and on top of the 66%, so making the part that the partners paid for much, much smaller. So you need to look at funding. There are other types of funding out there, normally a lot smaller than this Section 106. But it's worth having a look at some of the environmental funding that's out there now that might be in your areas. There was an NHS boiler scheme that could be looked at. So that's to have an improved, more environmental boiler. There are some environmental monies going in various places for outside space for things like cycle sheds, anything to get people moving in a more environmental manner. Some areas have been fortunate enough that there is money out there for businesses, not via the NHS, but generally money out there for businesses for solar panels. Things like that, everything's working more towards the environment. So these are all areas to consider and think, can we do something? Can we find a way of bringing in that funding as well as NHS funding and making it smaller and smaller, the amount that your partners would have to pay towards an extension? So that takes a little bit of background work to try and find some of that. And none of it is guaranteed. These are things that could be an additional part of funding that you'll need to go out and look for. And when we've got to that stage, we need to start thinking about writing our PID. Now, the PID I normally start, that's your project initiation document. I normally start gathering things to go towards the PID. The final PID cannot be finalised until you're further along. There are tenders to be put in, there's planning to be got. But it is worth keeping a little bit of control over what's going to go in that PID. And you can get this approved by your estates person at the ICB for them to have a look at before you spend that extra money and say, what do you think the chances are that this is going to go through? How likely is it? Because there is no good spending all that money if the estates lead at the ICB knows that perhaps this year there isn't any money, but there may be some after April. So get some ideas in your mind and then start working towards it. You need to start thinking of every area you want improved and really go strongly to your partners that changes that are made once that PID has gone in will actually start costing them money because you are costed at the PID amount and no more. You can't add to it once it's been agreed. So you need to finalise all of those different ideas and run through them again and again to get a final plan before you actually submit your PID. I would personally go to all your local councils if you are in an area with multiple on the councils where you're sat sort of in the middle of two, go to them both. If there's only one, that's easier. And get someone for you if you're busy, because this can be delegated down. You don't have to do all the work yourself, to contact the local council and ask about housing developments in the area. Even if there isn't any Section 106 money, that the knowledge about what's going on in your area can really add and make a stronger PID for your reasoning why you would like the NHS to pay for an extension for you. If you can prove there are lots more flats and houses going in, that will make your PID stronger. So get hold of your local council and find out what developments are in place for the next 5 years. Look at all areas of improvement in your building before you go in. So going back to those earlier slides, think about those sinks in certain rooms or new flooring somewhere else, any refurb that you can get done at the same time, which can improve your money. And I would also suggest reading the new premises directives. Get those out there, easily available on Google, and read through them to understand what position you're in, and then check with your ICB exactly what funding they're offering. So just as a little aside, you can see the whole process here. We don't get to the point of building until number 5. All of this 1, 2, 3, and 4 is all in the planning stages. So there is a lot more time spent planning than there is in building. So make sure you have the time available to think. So do remember, as I mentioned earlier, you may not get awarded your PID, so you then won't get the reimbursement for what you've spent so far. So make sure you can afford that. They're very strict on your tender process. It needs to be fair and equitable. It's often easier and will be considered an acceptable process if your architect does this in what they call a closed tender. Because that way it's not one of the partners having their brother-in-law or their friend coming in as a builder and being given the job. All designs need to be DDA compliant, NHS compliant, so as well. So that goes for your infection control. And there are a whole lot of new environmental laws that have also come in that also need to be compliant with. So you need to run over and make sure that everything's worthwhile. So it is worthwhile to make sure that your architect has that NHS background so they can happily look over that for you and make sure everything is compliant. When we move to the tender process, generally for a large extension or a new build, we look for 5 builders to tender. Some of the smaller things, which might be your room, a room being made from an admin room into a clinical space. So we're talking sort of a couple of thousand there. If you are going for funding for that, they normally will allow 3. It's amazing how hard it is to get proper NHS builders at the moment. So again, as you know, that list is in there, but ask around other places who have had a successful PID that are close by to you, and they may also be able to give you some names of builders. Your estates lead at the ICB should also be able to help. And if you've got an NHS approved architect, they will definitely know builders that they feel comfortable working with and that are fair and honest and NHS approved. So when that tender goes in, there will be a date and they will put in their tenders for the whole job. And then NHS England will only pay at the lowest tender price. And that will be, again, at the whole job. They won't look at one bit can be done by this builder and one by another. They understand the whole job is where it goes. But even if the lowest tender is paid for by NHS England, whether that's at 66% or a different percentage up to 100%, you can pick and choose a different builder, but you will not get anything more than the percentage agreed on the lowest tender. You won't, if you choose the most expensive builder, your partners will pay the difference, and we need to be very clear on that. They will also ask you a reason why you're not going with the lowest tender. Now, the only really acceptable reasons would really be that you were particularly uncomfortable with one of the builders who then got the lowest tender. And that could be a reason that there are rumours that they are going bust. It has happened. They've tendered in just to get that initial bit of money and gone under. But that's something your architect will probably be aware of, and so would the estates at NHS England, but not always. So do sort of check and find. You kind of felt particularly uncomfortable as they've come round to tender and looked at things said. And if somebody is walking around and tendering on your building and they are discussing something that you feel uncomfortable with, check it at the time, and if not, report that back to your architect. For instance, I overheard a conversation with someone who was tendering on one of mine, and he said quite happily in front of me that he was going to put in for new boilers, but just leave the old ones because they didn't look too bad. And when I questioned him on that, there was a little bit of a you're just a girl type of conversation, at which place I reported that to the architect who was doing the tenders and said, I'm not happy with this, and this needs to be made sure that this is qualified within his tender, that he is refusing to move out the boilers. So just listen and keep an eye on that. So although I say delegate certain things, I will always walk around with the builders and listen, because I have that knowledge and the background that I've dealt with this many times and dealt with many of them. It's very rare it happens, so I don't want to worry you. You also need, as part of your PID now, they're asking for extra documentation more than there ever was before. And part of that is to show that you have the support of your PPG. So you do need to bring these plans to your PPG and discuss with them. And then you can show minutes, or you can just note minutes available if requested. If there are other things in the minutes that you don't want to share with NHS England, but you do have to have an agreement and a discussion within a PCM meeting where the clinical director is prepared to sign off that they are happy for you to have an extension. And you also have to have a PCN estates plan. Now, you may have found that some areas, the ICB have produced these PCN estates plans for you, and that's generally if they're trying to maybe get you to move into a certain building, a shared space, they may have got that ready for you. If not, within the bundles of paperwork, I wrote my own PCN estates plan. And that the template for that is placed within the bundle so that you can put together quite a relatively straightforward PCN estates plan that won't take up too much of your time. I have had the question, so I will answer it here just in case it's a burning question for any of you. what to do if your PCN isn't a happy PCN and there are arguments within the PCN. It shouldn't be an issue because the clinical director has to have a really proper, valid reason to disagree in improving estates, because improving estates is improving that area for patients. And the clinical director should clinically want an improvement that is there in place for patients. They cannot disagree and refuse to sign it due to feeling that it would put you at a better advantage for patients joining your surgery, etc. And if that does happen, you can speak to the LMC about it or go to the ICB, but that shouldn't happen, because basically whatever the feeling is within your PCN, the clinical director is there supposedly neutral to look after all of the patients within the PCN, and making an improvement can only do that. So therefore you need to get that signed off. Once you get going with the job and actually building the extension, say you're working towards it, you've got plans, anything that's part of that planning, start to involve your patients. We've always found that updates on Facebook and on the website are useful. People like to have a look at them, ask questions, pop up some plans in the waiting area. Some of the architects will do one of these lovely big A3, is it? The bigger posters that they will allow you to put up with plans on, and these plans can help show people what you've got in mind, and that will give them a bit of a visual, and it also helps them not be quite so upset when they come in and perhaps there's a little bit of dust or a little bit of noise, because again, they can see the pictures and they can see what's coming, and it can be quite exciting. So involve your patients, get some comms out there, whether you use social media, websites, Twitter, if you go down, or X as it now is, anything that you use within your surgery that can involve your patients, then do so. If you have a newsletter, also quite a good place to pop things in. You do also these days, this is again a new one from last year, I believe it started, you need to have an IT assessment. This IT assessment is for NHS England to understand the new IT that will need to be brought in. This can be, it might just be some computers and some points, maybe a printer. It might be that the switch you have attached or your computer's attached, you will not cope with any more rooms, and that might need replacing. When you get this IT assessment, it will all be costed, but that costing is not added to your PID amount. It just needs to sit there neutrally side by side to it, because that's something that NHS England will pick up if your PID is agreed at 100%. So it doesn't need to be there within that final amount, but it has a separate section within the PID that asks for that. Easiest way to do that is don't attempt to do it yourself. Call the IT department, ask them to come round with a clear plan, show them your plan, show them the rooms you're planning, and ask them to cost it for you. They will have a look at your switch to make sure that you've got enough space on it, and they will look at everything else that's required, the wiring, etc. That doesn't cost you. You can just arrange an appointment with the ICB IT for your area, and they will come in and produce something for you. You may have to pretty it up. It might just be a one-page document, and you might have to add in some explanation, but they should provide the cost for you, and then you pop that into your PID. And then the next thing is, I'm afraid, to wait, and wait some more. A couple of years ago, they announced that they were going to take the bureaucracy out of the NHS and make it much easier for you. And I found that I went from a plan that I had to go through 2 meetings to the newer, less bureaucracy, going through 7 meetings. So I don't know where the less bureaucracy has happened, but it is a very slow process when that PID goes in, unless they have excess money that they need to use by year end. And that can happen. I've been lucky enough to suddenly get a call and say, if you can get everything in place by 2 months or a month's time and get going on it, we've had someone pull out of a project, so we've got some money, but we need to spend it by the end of March. So that can happen. So it is worth being ready and waiting. Do not be tempted to start early because funding can suddenly get pulled. You could have the agreement on the line, but until you've got it in writing with a defined amount, don't be tempted to start early, because you can have some sleepless nights if that money doesn't come through and it gets pulled due to funding changes within the NHS, and then your partners will have to foot the bill. So be careful. When the building work is going on, you will need to make a bit of plans. When you get your builder, you might have to discuss some weekend working for them. Think about keys and alarm codes. Do you need to have a member of staff on the premises while that's happening? Do you have a trustworthy feeling with the builders, or are they working outside, building that extension and then breaking through, as they call it, into the main part of the building? And if that's happening, there's no reason why they can't be on site at weekends. You have to ring your insurance people and make sure they're aware building is happening on site. They generally don't put your insurance up much. They need to see the builder's insurance, but it covers you if anything happens. You may need, if you're doing some work in your current building, to think about furniture storage. Where is that all going to go? Where are you going to put it? Do you have to cost in having some extra sheds or something put on site to keep the furniture in? Make sure you've got your computer points sorted out with the builders, so you're not adding in wires after the time. Plan your rooms out for your new rooms, get everything planned. And also do consider some weekend working perhaps for your team with a bit of extra money. And I always find a quick lunch put on is always helpful. If you're, for instance, having a lot of work finished on a Friday and you want to get your team in place on the Monday, it's quite nice if some of your team are prepared to come in on a Saturday for a bit of extra pay, of course, agreed, to come in and set up the desks, get everything set up so you're ready to roll. Make sure you have some straightforward stuff. I know it sounds really silly, but think about, can your handyman come in? Because there are bits that the builders will have finished and have a lovely room for you. But if you want some photographs on the walls, or you need a soap dispenser popping up, or even things like your notice boards to go up, this might be something that it's cheaper to pop a handyman doing, rather than if it's not costed within for your builders to do. A builder's costs are going to be at a higher rate than a generalized handyman. So think about all those things to have that room just right. If you are going to set up rooms over a weekend so they're ready to roll the next on the Monday morning, all looking glorious, if they are clinical rooms, I would always suggest that you get maybe a nurse, or if one of the partners is willing, to get one of them down, because they will look at the rooms differently. We may think something's put in a great place, which would work really well for the way we work, and then a clinician might think, actually, that doesn't work at all, because we need that piece of furniture to be right here for availability for the bed, etc. So the clinicians will think and look at a room in a clinical way. And if you can have a nurse on site helping you make sure the rooms are clinically set up, that's great. You also need to have a builder's clean, or an official proper clean that is done at the end to get things absolutely clinical and get rid of all of that builder's dust. Your builders will probably have a half-hearted builder's clean in there. Unless it's particularly been costed in, you will probably need to get a cleaning company to come in and clean it, and then certify that it is clean enough for a clinician to come in. Generally they have some certification if they're working for GP surgeries. So we need to plan that for timings as well. If you're planning to use those rooms, it's not the moment it's finished. Someone can jump in there. Someone still has to pop in the desks, sort out the furniture, organise that there's maybe a stethoscope in the room, or whatever other clinical bits that you like to have in your rooms, that maybe your doctors don't bring their own in. Have the room all set up, maybe a trolley with stuff on, blood bottles, everything they're going to need, so that it's a seamless transaction as they come in. When you are going through the building stages, there are a lot of submissions that need to go in during that during that time. This is submissions that go in to for building regulations to say that regulations have been followed. These are quite challenging. Please don't let your partners tell you that the architect's job is finished when he has planned the building and you can project manage the building. It is very challenging to project manage this unless you have a real deep understanding. Often the architect will project manage for you before your PID goes in. Make sure that you have got their plan for project managing costed up ahead. It's normally a set amount a month, and they're looking at a 6 months or a year bill, depending on how big this extension is, and get that costed into your PID so that you get your percentage off that. Personally, I only project manage the money and the dealing with the legals. So I will have meetings when I'm consulting on this. I do the money side, keeping control of that, claiming for the PIDs, talking to the solicitors, lawyers, if you have got to get legal representing, which is more for a new build when it gets to the point or dealing with lease as well. I deal with the ICB and the estate side of things, so I can formulate and get everything together, and that's the area that I cover generally. I would leave the architect to work with those formal and legal submissions, and then my job is to make sure that those are all held in a digital folder ready for my partners to be able to look at and make sure they are covered for everything, and make sure everything's there if I've moved on or if I'm doing this on behalf of a different surgery, so the current practice manager knows where they are, because you're not going to be working there forever. You will retire at some point or you will move on, and that paperwork needs to be there if they ever sell that building. So be careful, but also do get that costed in for project managing the building if that's what they're going to do. They also deal with the builders, making sure the builders are keeping to their regs, and that might be something I certainly wouldn't know enough about. And if it's your first time doing it, I'm sure you probably want some help with that. It's also an awful lot of time consuming work, so make sure that your partners are very aware that if you take on an extension, this is a lot of work for you, and you can't take on all the project management of managing the builders, coming in at weekends, doing everything. You are one person. You also have to consider, and your architect will help you with this as part of that project managing, the health and safety part. So it's not just looking at where the exits are, but it's making sure that you have a fire plan in place for that. All your fire equipment is up to date. You may have to buy new extinguishers for that area. You may need to get your alarms moved so that they cover more of an area. And there's a lot of signage that needs to be up and regulated. So make sure that you've got all the correct health and safety signage up, which will keep you legal. So I'm just going to show you a very small case study of one of the extensions that I had put on. So this is the back of the extension, while, as you can see, the ARRS fencing still up, so we were still doing the building work, and we added a 2-story extension here. Again, the doctors would have been happy with the 4 clinical rooms being added, but the cost to add on a little bit extra worked really well. And as it was a 2-story building, it looked seamless along the sides, although there's not a picture of that. It looked very seamless, and it was a beautiful extension because it just looked like a continuation of the initial building. We added on 4 clinical rooms in the downstairs space. This was a typical clinical room. So although this looks like wood floor, it isn't, it's safety floor. The partners in that particular surgery particularly wanted the wood look, so that's what we went with, and that's there for you to sort of have a look at and get some ideas from. We were actually at the time moving from one building to another, so we had some old furniture to move across, so we reused that within those areas. We made an IT plan for moving our computers. And the reason we did this is the partners were going to have the new rooms and their computers were set up for them. So we made sure we moved their computers across into the new rooms they were going to be in, just so that they felt comfortable with something they were familiar with. Have a little think as well when you're adding on rooms. We had one of the nurses' rooms made into what we would consider a pandemic room by having an extra door that went from that room directly to outside, so that if we do have another COVID situation, we've got a room where people can come from outside and go directly into a room without coming through the waiting area, waiting outside. So therefore it was considered a pandemic room for less risk. So we had that extra door put in. But this is, as I say, one of the rooms. And then we use the upstairs space to make a large admin room and also a very nice meeting room, which then worked out for some of our PCM meetings, etc., to be popped into place. We didn't want to add any extra waiting area because that would have taken away a clinical room. We had quite a reasonable waiting area, but we added a waiting area in a corridor, which you're allowed to do if your corridor is wide enough and your seats don't face each other. So therefore, we made the corridor slightly wider, still giving our rooms enough space, and we could have this waiting area in the corridor, which led down to the exit, an outdoor exit, which okay is a fire exit, but it also has that nice added light coming into the corridor, bathing it in light. We did also do a little bit of work on the outside space when we did this. Just bought some tables and chairs to sit outside for the staff to, there was a small grass area, giving them that nice little bit of extra staff space in the summer where they could enjoy some outside space. Sometimes a little bit of thought in for your staff makes them feel more wanted and more worthwhile. So that really helps. And the payments, just for you to be aware of, they come from the ICB monthly only if you put in a claim. So you need to submit your invoices and fill out a form which your ICB will give you. Each ICB working on behalf of NHS England has a slightly different form. You do have to calculate within that form the amount you're allowed to claim. So you will have your set amount that you know your end result will be for claiming. If, for instance, you are given 50% as a funding marker, then each bill that goes in, you will only be able to claim 50% back off each bill until you have reached your final large amount. And that's because people sometimes will try and claim everything back and then only do half the work. So the ICB have made it that you only get your percentage back off each bill. Obviously, if you save up all those bills from before your submission is agreed, then you can put all of those in at once when you first get agreed, and that will come out on your monthly statement that you can see on PCSE. So your GMS or your PMS statement, there will be a line on there telling you your percentage of your capital grant that's been paid. So you will get that monthly until the money has all been drawn down. So if you take a long time doing your build, it will take a long time for you to get back that money, but it will be a slow drip feed, maybe giving you time to save in between. So hopefully that's been useful for you. I'd like to thank you for spending some time with me today. As I explained, there is some paperwork that you'll be able to get sent through to you, and that will be explained when you get your link for this. That paperwork will include a document that, as I explained, was a Lancashire document, but it will give you an idea and an explanation on Section 106 monies and community infrastructure levy funding, or SIL money. So there is an explanation of that worth a read so you understand what's happening, and then you can ask your local ICB if that's money that's available for you. There is an example document of room usage, because you will need to complete one of those and have that embedded into your PID. There is an example of your primary care network estates plan. So there's a template there for you to use. There is a list of useful local services, people that can cover architects, NHS approved architects, NHS approved builders, NHS approved flooring firms, will all be there if you need those particular additions, if you don't know people locally yourself. And finally, there will be a copy of a PID, your Premises Improvement Grant application form, in the format that I've never had a PID turned down yet. So this is the way I would write a PID, and hopefully you will be able to have a look at that and work that out, adding in the bits you need. You won't be able to submit it like this, but it should give you an idea of the tone to use to be able to be more likely to have your grant improved. I really wish you the best of luck in anything you're doing with getting an extension or just improving your current space. And my biggest thing is get rid of that clutter, because it's amazing when the clutter disappears. You actually may find that you've got some space that you can just utilize anyway, but think outside that box. Can we move some desks? Can we place things slightly differently? Get that graph paper, draw it all out, get another pair of eyes on it and have a think, because you may not need that extension. You may be able to work within the space you have and just thinking a little bit differently about it. And hopefully that will work for you. So thank you very much for your time, and hopefully I'll see you on another webinar or recording in the future. Thank you and goodbye.